So today we are discussing the new UAE pharmaceutical law that came into place at the end of last year, but is being implemented starting in January 2025 with a grace period until the end of the year. It's set to modernize the regulatory landscape in the UAE and goes hand in hand with the shift of the regulator from the Ministry of Health and Prevention to the EDE. My name is Christina Sochacki, and I am head of our healthcare and life sciences practice with Tamimi and Company. And I'm joined today by my colleague, Mike. I'll let you introduce yourself.
Hi, I'm Michael Eybers, and I'm an associate in our healthcare and life sciences team.
Fantastic. So pharmaceutical companies are asking us, what do they need to know about this new law? We are seeing quite a few changes in just even the way the regulators are formed. The movement from the Ministry of Health and Prevention over to the new EDE. What do they have to know?
One of the things that we have seen that has taken place is that the staff from the Ministry of Health and Prevention has moved over to the Emirates Drug Establishment. And so that regulator is set up. Although currently, when it comes to applications for medical devices and pharmaceuticals, we are still running those applications through the MOHAP portal. And over time, we'll see that that will change. Eventually, the EDE will have their own structures and so on. And one of the great things about this law, when it comes to the application processes, is that the new framework allows for streamlined and easier and quicker processes. And one of the biggest benefits of this is when it comes to rare diseases, orphan drugs, or in those instances of public health emergency events such as pandemics or the next COVID epidemic. Then the regulator has the power to fast track the registration of medicines, and therefore the public has access to better healthcare opportunities.
Much quicker, yeah. So one of the stark changes I think that has really jumped out to pharmaceutical companies and distributors in the UAE, we've seen most recently there has been changes to the UAE's commercial agency law, and kind of along those lines of changing the relationship between foreign principals and their distributor. Tell me, I think you know what I'm talking about. Tell me about what we see in the law and where maybe the gaps are that the regulators are going to have to fill through the executive regulations.
Correct. So with the change in the commercial agencies law, we are seeing this transition from the historic position where exclusive agencies would be registered and their position in the market would be solidified. Very difficult to change those existing relationships. This position still exists for those agencies that are registered. Those will continue to exist. And now with the new law, there's a nuanced difference on this, where the new law requires that in an agency situation, there are at least 2 importers and 1 distributor. So where there has been in the past a registered agency where the function of importing and distribution has been given to 1 exclusive agent, what will be the impacts of the new law where those functions now need to be separated, or at least the function of importing? Right. We now need to see 2 agents fulfilling that function. And we are yet to see how the law will develop and whether these exclusive agencies, what the relationship, what the commercial impact is going to be.
Sure, because that's going to be critical. I can see some changes coming out and anticipated for any new products to be registered. But I think their executive regulations will have to address for those who have 1 importer, 1 agent, perhaps even exclusive, and have had that for quite some time, balancing that with the actual commercial agency law, then the executive regulations and the new pharmaceutical law, and what will be mandated there will be, I think, a very hot topic as the executive regulations come out. And I know that will be the first thing I'll be looking for, of where that's addressed in the regulation and addressing that to our pharmaceutical clients. Maybe the last point that I've been hearing about, which is quite interesting for the future of investment in the healthcare sector, which is, of course, quite important to the UAE, and is that the EDE can apparently now has the authority to form companies?
Correct. As I mentioned at the beginning, there's far more wide-reaching powers granted to the new regulator, and one of these is to set up its own companies and its own businesses under those companies. And this definitely provides an opportunity and a platform for foreign investment. We'll probably be seeing a lot more public-private partnerships through those companies, joint venture arrangements, where the private sector and the public sector, through this new regulator, they can set up companies and do business together. And it really makes it an attractive landscape for the pharmaceutical industry in our country.
Fantastic. So this will certainly be a regulation that we stay on top of heading into 2025. And definitely you can follow our Healthcare and Life Sciences LinkedIn page for when we will be posting about the executive regulations, and pleased to help you.